Manton has been identified as an area that experiences massive health inequalities when compared to the other parts of Bassetlaw and Nottinghamshire. Statistics highlight a number of serious public health priorities, but what do the people of Manton think? Over the last few months, meetings and events have taken place to hear the views of people living and working in Manton about their health needs and the health and social care services available to them. But have we really heard them? Manton Can is a group of Manton residents who are skilled in finding out what Manton residents really think. Together with Manton Community Alliance, they have used a range of new and inventive ways to talk to the people of Manton and find out what the priorities are for local people and what they and others need to do to improve their health.
And do you think you are very healthy?
Yeah. I try to be healthy, but I'm not as healthy as I should be.
Yeah. I walk everywhere because I don't drive. I used to do a lot of sports when I was younger, but because of health I can't do that at the moment. But I do like to take the kids swimming, to the park, have a kick about, and I'm a kid so I get on the swings and stuff as well.
No, I'm not healthy at all.
What kind of things do you think make a person healthy?
Good diet, exercise, lots of fruit and veg.
Do you think there's any difference between being healthy and being fit?
No, not really. One the same, you can't have one without the other.
Playing sport, eating fruit and veg and drinking water. Football. Vegetables.
Yeah.
And tomatoes.
And what kind of vegetables do you like to eat? All of them? Potatoes, peas, cabbage, carrots. That's very good.
And veg and exercise.
Fruit?
Well, exercising a lot and eating fruit and vegetables.
Well, lots of walking. We do lots of walking, don't we? But yeah, lots of walking is good.
Apples, bananas, potatoes, carrots.
Your 5 fruit and veg day. Healthy balance between your dairies and your fats, not too much starch and plenty of water.
Do you think there's plenty of places to go where you can walk and get exercise where you live around Manton?
Yeah, it's not bad.
What about your kids?
They can't really go unsupervised.
Do you think there's anything that you can do to make you feel healthier?
Eating the vegetables and fruit. I'm going to food co-op. Eat a few more veg.
Well, diet out. Yeah, I might start walking a lot more actually because I've enjoyed today.
Yeah.
Stop eating sweets and eating more fruit and veg. Eating more fruit and veg.
Well, eating well, a well-balanced diet, but it's not just all about what you eat, it's the way you feel. You know, having friends around you, somebody to talk to, get things off your mind, share things, exercise.
So,
Drink some more water. Drink more water.
We need exercise and we need some sort of diet club.
I have a teenage son and there's a lot of peer pressure with what they eat and latest video games and things, so yeah, I think as a parent you should keep that in check with your kids.
Go to the gym.
Well, people can't always afford to join gym membership. It's hard to get out of Manton, especially with children. If you don't drive, you have to.
More exercise, eating better, stop drinking.
Exercising, jogging, walking.
Residents identified over 40 issues that they believe would improve health and health services in Manton. Using these issues, Manton Can designed the Health Bingo game, where residents selected what they thought were the 10 most important. The Health Bingo was completed in a range of venues and locations in Manton to make sure that the views of all ages and gender were reflected. Using this approach, Manton residents not only got to have a say about what they believe to be the issues impacting on health, but they also identified what they believe to be the top 10 priorities. Then we asked some of the people attending the food co-op if they agreed with the results.
I think we need knit nurse back. If the knit nurse came back, she could give you advice on what to use to get rid of the knits and how to do it properly.
I live in a council property and I'm fed up of dogging for repairs to be done. A1 housing. And I'm asking time and time again to get repairs done, and it's not happening. It affects my little boy's health because he's got asthma and he's got damp upstairs and things. So it doesn't affect my health, it just affects my stress levels every time. I came to measure my windows 3 years ago. I hadn't had a window fitted yet. Measured my kitchen and said no. You've seen it out here, it's dropping to bits, everything. We've actually put into buy it now, we're sick of waiting for the council to do it for us, we'll do it ourselves now. So.
I do believe that we want a doctor's and a chemist nearer to us. It's very hard to get hold of a prescription and go up to town and collect it at the same time.
Oh yeah, that would make things a lot easier.
It would be easy, but wouldn't it be hard for doctors to have to carry people's notes, and notes are going to get lost if you're transferring them from place to place?
Sometimes you just get sick in the middle of nowhere and you need to get them for some assistance really quickly. It would be appropriate if they could get there quickly now. Because I found that to catch a bus is easier than having to go to town and get another one to Lowood. Yeah. When you're like me, you don't drive, so it becomes easier when you can just catch one bus if I really have to. But if it's not too bad and it takes like about half an hour to walk and the weather is good, you just walk. But it would be very nice if we could get one a bit closer.
One doctor's surgery closer for everybody to use, so it's closer, and they should have late night ones as well in case of emergencies. Right. Closer to Manton.
Especially like when you have what do they call them, when you have this subscription that
prescription,
yeah, a repeat subscription. Yeah, then if you live like maybe up here, then you have to go all the way up to Newgate to get a prescription for. And you're not like maybe somebody really old and not really able to drive or not able to get somebody to get them their prescription. It would be very ideal if those were closer.
For prescriptions, these drug addicts or whatever, phoning up and getting prescriptions and health treatment far too easy than when they don't need it. They're not even helping the sense, so why should anybody else help them? When there's people out there that do need help and they're not getting help, they're having to go on a waiting list or whatever. It's just easy to write something out and just to get rid of a patient like that, isn't it? Rather than this.
Well, we could do with some form of transport to get particularly mothers to and from hospitals, doctors, because it's very inconvenient, especially when they've got young children. And any sort of minibus or something along them lines would make things a lot easier.
I'm actually quite happy with doctor service. Well, what service I get from doctors. I can always get in and see my doctor when I want to. And I've got Dr. Ross there, and I can always.
What if you wanted to book an appointment?
No, obviously not now, but I couldn't go today. But if I rang up and said, "Can I see Dr. Rossi next week?" They never say, "No, you've got to see another doctor."
We have to go over to Angold once a week to see Matt's team of social workers, psychiatrists, psychologists, so that we can make him better, really. Yeah, we have to pay for taxis if we're going early in the morning because it's too early to catch a bus, and then we have to catch a bus and coming home, and then Matt has to be out of school half a day. It's difficult to get out of the weight pushchair.
When you all go together, you have to get two taxis.
Yeah, when we all go together, we have to go in 2 taxis. If it were closer to Manton, we wouldn't have to take him out of school, so we'd just be able to go after school appointments. Even when the appointments are 4:30, we still have to take him out of school at dinner time to get over there. If it was in Manton, it'd be a lot cheaper for us and it'd be a lot easier.
Shrewsbury Road Community Centre, I think, is a big building, so they should do something for, I don't know, everybody.
What about that centre on Shrewsbury Road? Could that not be used for an health centre for Manton people?
The purpose of this listening event is to consider and address the issues identified by the community, and to ensure that these issues are part of the strategic health plan to address public health priorities in Manton. with the aim of bringing about a real and sustainable change. This is not just about the Primary Care Trust, because no one agency can single-handedly address these issues. We all have a responsibility to make this happen, which is why partnership working, with the residents included as equal partners, is so important. So the question remains, are we listening and have we heard?